Welcome to all of our friends and supporters. We are exceptionally excited to be with you today as we celebrate a glance at our past, our present, and our future. We hope that you will enjoy this celebration and that you will stay on the line, after which we will have a brief press conference with key players in the lives of children in Columbus. We hope you enjoy.
Welcome to a celebration of 5 years of dedication, community partnerships, and commitment to eliminating infant mortality and ensuring babies in Columbus and Franklin County thrive to their first birthday and beyond. It started with the collaboration and vision of a group of leaders back in 2014. The Columbus Infant Mortality Task Force were brought together because of a distressing statistic. More than 150 babies in Franklin County were dying each year before the age of 1. That's a baby every 3 days. We knew something had to be done. And this task force created the foundation for the work that would become known as CelebrateOne. This journey today starts with recognizing the strategy of 8 recommendations and the work done to reduce the number of babies threatened by prematurity, unsafe sleep, and the social determinants of health. And yes, we know we still have challenges ahead of us, but we're going into the next phase of this journey, reflective of what worked and what we need to improve upon to close the racial disparity gap.
Thank you for attending and celebrating the impact made on infant mortality in the city of Columbus and all of Franklin County. I'm Maureen Stapleton, the recently appointed Executive Director of CelebrateOne, and I am honored to be a part of this celebration and to help showcase the results of 6 years of work in our community. Enjoy the celebration of the many who have collaborated on this effort, and stay with us as we look toward the future to ensure we eliminate infant mortality and set all our neighborhoods up for equal opportunity to prosper.
You know, CelebrateOne started as a concept, a call to action for our entire community to rally around an urgent cause.
There were too many babies in Franklin County that were dying before their first birthday. And too many of those babies were clients of Franklin County Department of Job and Family Services and other agencies within Franklin County. And so we decided that we could be impactful. We decided that we could make a difference.
We understood that community education was key and that the faith community needed to be an integral part of carrying out that vision to ensure that every baby has a health and safe first year of life.
The mayor kicked us off by pulling together people from every aspect of the community that could touch the lives of women and children and families in our neighborhoods, especially the high impact neighborhoods.
And we had a report, barely a budget, but some really powerful people at the table saying, We cannot let this happen in our community on our watch.
We had individuals from healthcare, we had individuals from nonprofit, from for-profit, and we invited experts from outside of the community who had already engaged in this work to help us identify not just best practices, but practices that would align with our community.
And you just found unlikely partners that said, this is an urgent cause. We want all babies to thrive here in Columbus. And they just stacked hands.
One of the marvelous things about our community is how collaborative that the 4 hospital systems all are when they're pursuing issues of the community's needs. And this is one that we brought to our adult healthcare partners, and they immediately said, yes, this is something we want to participate in. This is something that we think the community needs.
When we started this work, we looked at what everybody else around the country was doing. We looked at all of their models. We emulated what was working well, and we took best examples, best practices from what they were doing, and then we created our own model. And we've all been working together for the last 6 years to create a model that we think others will follow.
It was profound, to be perfectly honest. So I think the accomplishments are so many, too many to name, but ultimately, when we see movement in our infant mortality rate for the better, and again, restoring families, there's nothing better than that.
The foundation of the CelebrateOne work was and is grounded in the 8 recommendations made from the Greater Infant Mortality Task Force back in 2014. These recommendations were created using evidence-based practices to improve maternal and infant health.
I am proud to be in a community focused on saving precious lives of moms and babies and leading CelebrateOne in this banner year. Infant mortality, or the death of a baby before its first birthday, is tragic and complicated. There is no straightforward solution because its contributing factors are numerous and intertwined. Back in 2014, we were at 9.6 deaths per 1,000 births. And by the end of 2019, we are reported at 6.9 deaths per 1,000 births. Now every family watches a video on safe sleep practices before heading home from the hospital. We have distributed over 5,000 cribs since 2017, and we have gone from training 621 sleep ambassadors in 2017 to over 950 in 2019, and are expected to train over 1,000 this year.
We're proud of the progress that has been made and the success of moving the needle on all of the task force recommendations. You don't have to take my word for it. Listen to a mom who would tell her story on how she was helped through CelebrateOne to have a healthy baby.
My son is actually 4 years old. He's a CelebrateOne kid. And my daughter here is 10 months old. So I learned about CelebrateOne through a good friend of mine. They've assisted me actually with both of my children, my son and my 10-month-old daughter here. And actually, my friend Sarah, who works with them, she's been able to link me up with people to provide me a pack and play through her Safe Sleep initiative, which was very helpful. I didn't have anywhere for my daughter to stay. Right now, we're in a rough time with the pandemic, and it seems like a lot of things have stopped, but it hasn't. CelebrateOne is going strong during the pandemic. They've got the virtual stroller socials. I've had non-touch drop-offs for things like clothes and food. Everything they've been doing in person, they've been able to do virtually during this pandemic. I absolutely would recommend them. To anybody needing help, anybody needing resources, or just to be pointed in the right direction.
Back in 2014, when we began, the non-Hispanic Black infant mortality rate was 17.1. With the work of CelebrateOne and its partners, that rate has dropped to 11.4, a 33% decrease in Black infant mortality. We've also lowered the infant mortality rate for non-Hispanic white babies from 7.5 in 2014 to 4.3 at the end of 2019. Between 2011 and 2013, we experienced an average of 22 sleep-related infant deaths per year. We brought that average down to 18 per year between 2017 and 2019. At the end of 2019, CelebrateOne, Columbus Public Health, and our many partners had distributed a free crib to nearly 10% of families with a newborn baby. We have progressively trained thousands of our neighbors throughout the community as safe sleep ambassadors. We know that a woman is more likely to have a healthy birth if she obtains prenatal care. The earlier, the better. The Step 1 program at Physicians Care Connection has been an integral player in connecting women with prenatal care. Smoking during pregnancy can increase the chances of a poor birth outcome. One of our most successful programs is the Baby and Me Tobacco-Free program through Columbus Public Health. In 2019, 100% of those enrolled in the program stayed smoke-free. Our community baby showers have invited many families to the table, providing needed supplies and education to keep their newborns safe. Our first birthday parties celebrate all the babies who have reached the age of 1. There are 8 neighborhoods in Columbus where the infant mortality rate is up to 3 times higher than the county, state, and national average. These neighborhoods include Linden, the near South Side and the near East Side, the Hilltop, Franklinton, the Northeast, Southeast, and Northland areas. A big part of the success of CelebrateOne has been the focus put on these 8 neighborhoods by providing a health worker or connector who educates and supports pregnant and new moms to navigate resources to have a healthy baby. Each year, the number of women served has increased, and it goes without saying, so have the number of partners and organizations who dedicate themselves to helping women. Our team of community health workers, the Connector Corps, has reached thousands of pregnant women and families with children under the age of 1. In 2019, our team of community outreach workers connected with over 5,000 women and their families and connected them with services including a crib for safe sleep, baby items like diapers and wipes, prenatal support through great programs like Moms to Be, and prenatal care. Thousands of families in our community have been connected with home visiting services. We know that housing insecurity can have devastating effects on a healthy pregnancy. The Central Ohio Hospital Council has prioritized making sure women who are at risk for very low birth weight births deliver at a hospital well equipped to treat them.
Teen pregnancies for ages 15 to 19 account for 4.5% of all pregnancies in Franklin County. In 2019, Columbus City Schools partnered with CelebrateOne and Nationwide Children's to provide evidence-based, medically accurate, and comprehensive reproductive health education using the curriculum Get Real for 7th graders in all CCS middle schools by December 2022. Approximately 450 students were taught Get Real last spring before the COVID-19 pandemic. As we continue to create interventions and programs that address infant mortality and maternal health, it is critical that we continue to develop programs like the TPP that address the social determinants of health earlier in the life of the mother and baby. We must go upstream with our interventions. This has been a citywide and countywide effort, from government to private sector, from elected officials to the philanthropic community. We would not have been successful without so many at the table.
The beauty of CelebrateOne and it being a great model is all the partners that are involved in it, from the Central Ohio Hospital Council to the Columbus Public Health, to Bob's to Be, to the Ohio Department of Health, to the Center for Healthy Families, just to name a few of the organizations. But it really is a collective effort to be able to address infant mortality.
You know, here in Franklin County and here in Central Ohio, the city, the county, the partnership that we put together with the city, the county, the business community, not-for-profit organizations, it's just such a great partnership.
In May 15, 2015, I, along with some other women from the faith community, were invited to a meeting at the governor's residence. Following that meeting, we were commissioned to reach out to some women in our local congregations and assemblies that could assist in meeting and moving forward with the initiative. So having been a mother who birthed 2 premature children, I understood the plight, and I knew well that where we live, where we learn, where we play has an impact on our health.
Moms to Be and CelebrateOne have been critical partners in this effort to reduce infant mortality and especially reduce disparities. We have common missions. That is a key in our relationship and developing trust in each other.
And the ground that CelebrateOne has covered over the last 5 years can only come about through partnership. No one can do this work alone. And CelebrateOne is definitely the beneficiary of efforts that demonstrate what happens when people come together after, on behalf of a single cause.
Our leading partners in this effort also reflect the diversity and magnitude of the commitment. Columbus City Council, Central Ohio Hospital Council, Columbus Department of Development, Columbus Public Health, Franklin County Board of Commissioners, Franklin County Department of Job and Family Services, Franklin County Families and Children First Council, Moms to Be, Better Birth Outcomes Collaborative, Ohio Department of Health, Ohio Department of Medicaid, Physicians Care Connection, Healthcare Collaborative of Greater Columbus, and the Columbus Foundation, our fiduciary partners. Thank you to our Medicaid sub-grantee partners. Thank you to our home visiting partners. Thank you to our Healthy Beginning at Home partners. Thank you to our teen reproductive health education partners. Thank you to our coalitions and our event partners. Thank you to our non-traditional and faith partners. Our donors, members of our current and former board of directors, the CelebrateOne staff.
So out of all the accomplishments that I am the most proud of, it's really that we're still here, that this initiative is still here, because that gets back to the need for sustained engagement over time.
One of my fondest memories, and something I'm so proud of, is our mayor. Mayor Andrew Ginther did not have to lead on this initiative like he did. And when I speak to people about CelebrateOne, about how we do things in Columbus, Ohio, it starts with leadership.
When I got the mayor, I was totally surprised, but I was so encouraged because he was trying to shine a light on a very dark place in our community. We have a wonderful community, but taking a leadership role in trying to understand this dark place where babies were dying, at alarming rates, especially Black babies, was not news to me, but the severity of it was news to me. And so the call I got from the mayor was one where at first I wasn't sure I was up to the task. And then I quickly realized, how could I say no? This was too important, and it touched too many aspects of our community, especially around social determinants of health. So I said yes to the mayor, and I'm glad I did.
I was honored to step up when Mayor Ginther, then Council President Ginther, asked me to be a part of it. And the reason was I knew that Franklin County and the work that we do on a daily basis, it was just went hand in glove with the work that CelebrateOne was going to be doing over the coming years. I knew that everything that we do as an organization and all of the clients that we serve, we're going to be so impacted by the work of this task force, the work that CelebrateOne does every day.
There's not many spaces that have the energy and the magic of CelebrateOne. The staff and the team were committed.
While there's a lot of work still to be done, we knew we had something wonderful right away. And so the coming years, I think, are exciting. And so very much excited for the future of this program, very much excited for the babies and the families in Central Ohio and in Franklin County.
We are grateful and celebrate all the amazing work by the many dedicated partners. As we plan for the future, we cannot let up on closing the disparity gap between white non-Hispanic babies and Black non-Hispanic babies. We have to think differently and focus on areas where we can make a bigger impact. We want to be the first large city in America that eradicates infant mortality in the nation, especially in Black babies. We can do this. We are not giving up. In fact, we are doubling down and building on what works and pivoting in order to close the disparity gaps. We can and will get this done by our next banner year. We at CelebrateOne envision a community where every infant, regardless of race, zip code, or family income, celebrates his or her first birthday. We thank you for being with us today, and we ask that you stay on the line as we turn to our press conference, where we will share what's next in the life of CelebrateOne.
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 CelebrateOne, baby.
CelebrateOne.
CelebrateOne.
We certainly hope that you enjoyed our celebration. I'd like to introduce Mayor Andrew Ginther.
Good morning, Maureen, and good morning to everybody who's joined us here today. I want to thank Tim Robinson, the CEO of Nationwide Children's Hospital, Director Maureen Stapleton, and all of the CelebrateOne team, a dynamic and wonderful group of leaders in our community who are making such a huge difference in the lives of children and families. All of our community partners couldn't be more excited to be with you today. There are many things to celebrate about CelebrateOne's progress and the decrease of infant mortality in our community. but we know there's still so much work to be done. In 2014, we set our sights on the Healthy People 2020 goal through the end of 2020 to decrease the infant mortality rate by 29%. Through the end of 2019, we had achieved an 18% decrease in infant mortality rates. We're still awaiting data for 2020. In the next phase of our work, we will be working toward the Healthy People 2030 goal for an additional 28% decrease in infant mortality. Let me be clear. We will not be able to reach this goal unless everyone is with us, and we continue to build on the incredible momentum for change and healthier outcomes for our youngest residents. That must mean we have to address racial disparities, and that has to be the focus of our work and the lens that we look through in our approach on every aspect of that work. The racial disparity ratio for our community still shows that non-Hispanic Black babies die at a rate that is 2.5 times higher than non-Hispanic white babies. In the next phase of this work, we will be laser focused on addressing racism and its impact on birth outcomes. To get there, we must strengthen partnerships in our community and develop aggressive new strategies, programs, and interventions. To that end, we'll be engaging a broad cross-section of stakeholders, hospital partners like Nationwide Children's Hospital, faith and business leaders, community agencies, city and county agencies, and members of our community with lived experiences of the challenges many of our families face. We've engaged a national consulting firm with a strong Ohio presence and strong credentials in health equity and disparity reduction efforts to help facilitate our planning process. We have worked to prepare not only CelebrateOne's leadership, but all city leaders for the racial equity work ahead of us. In November, I brought in the Race Equity Institute to take my entire cabinet and their directors through a half day of training on race equity. That company will return in January to work with our lead entities and partners. We will thoughtfully look at the actions and projects of the initiative that have been successful. Recognizing the challenges ahead of us, we will also be taking a hard look at what we have to do differently to eliminate racial disparities and reduce infant mortality in Central Ohio. We will tackle challenges ahead of us alongside our families, like poverty, housing insecurity, food insecurity, education, and other social determinants of health that impact infant and maternal health outcomes. Together, we can tackle these challenges and ensure the promise that every baby in our community makes it to her first birthday and thrives in their earliest years of life. It's now my pleasure to introduce Tim Robinson, CEO of Nationwide Children's Hospital, to talk about the partnership and engagement of our health systems, medical approaches, and lessons we are learning from the hospital entities throughout Ohio. Good morning, Tim.
Good morning, Mayor. And thank you for your leadership and your long-term commitment to health equity. We at Nationwide Children's stand with you in your fight against systemic racism and for health equity. So we're just so proud to be with you. I want to express my thrill about having Director Stapleton leading CelebrateOne. I was part of the search committee and was really impressed with all of her great experience and credentials. We are so well positioned to take us to the next level. So I really look forward to working with her. I am proud to be here representing our colleagues at the Ohio State University, Wexner Medical Center, Ohio Health, Mount Carmel, and our area's federally qualified health centers. Together, we form the Ohio Better Birth Outcomes Collaborative, and we're the healthcare partners to CelebrateOne. We are focused on expanding access to high-quality perinatal care, reducing preterm births, improving reproductive health, and providing best possible care once children are born. So one of this community's great strengths is the ability of our healthcare system to collaborate for the common good. You've seen this very publicly in our response to COVID-19 this year, but we work so well together because we're used to doing it. It's really the Columbus way. We've seen great success over the past 5 years and will continue to be successful in the years to come. It's important that CelebrateOne and OBO plan together because some challenges can only be overcome with strong collaborations. For example, while our infant mortality rate has come down, preterm births in Columbus have remained flat over the last several years, hovering between 10.5 and 10.9% of births in our community, and we must reduce that number. It is such a critical factor. And this type of challenge cannot be solved solely by addressing healthcare issues. Social determinants of health, racism, and other factors play a big role in these outcomes. We look forward to the next phase of this work. CelebrateOne and OBO will be planning hand in hand because we have seen that working and planning in a coordinated fashion gets us better results. Really, collaboration really does work. We know that we need to do more. Our babies, mothers, and families deserve more. And throughout the next several years, we have some challenging but not impossible work, and we know that we're going to be successful. So thank you.
Well, thank you, Mayor Ginther, and thank you, Mr. Robinson. As was mentioned, great work still lies ahead of us. We will be laser focused on health equity. We will engage a broad set of stakeholders, including our lead entities, other service providers and partners, our hospital systems, our health centers, state and local government, community and faith organizations, private partners, and members of our community with lived experience to forge the pathway forward. As Mayor Ginther alluded to, we will be working with a national consulting firm. Guidehouse is a leading professional service and health advisory firm. It started as a carved out public sector practice of PricewaterhouseCoopers. They come with a wide range of expertise within strategic planning, public health, community engagement, and cutting edge public health initiatives that will help CelebrateOne to prioritize equity and inclusion as core values of our work. As an aspect of our focus on equity and disparities, we will continue to look for ways to expand our work with African American service organizations. A good example of this is ROOT, Restoring Our Own Through Transformation, which reports providing full spectrum doula services with just 100 births between 2018 and 2020. Zero, it's important to note, zero maternal and infant death, with only 6% NICU stays. That's impressive, and we need to replicate that work. The process will be dynamic. We will be working through a series of strategic planning sessions, community engagement activities, which will include surveys and focus groups. As the video indicated, we want to be the first major city to get this done. We are going to radically do things differently and look for innovative ways to provide services to our citizens. We will be working to communicate with all stakeholders to show what we have accomplished before and in the future. We want babies to be born healthy and keep them thriving well into their infant, toddler, adolescent, and adult years. We are excited and ready for CelebrateOne 2.0. Thank you.
Thank you again, Director Stapleton, and thanks again to Tim Robinson and the entire team at Nationwide Children's Hospital for their partnership in this important work. As you all know, I've been committed to reducing infant mortality since I was City Council President. I knew then, as I know now, that it wouldn't be easy work. If the solution was easy, we would have already done it. But because the problem is difficult, does not mean or shouldn't or can't be addressed, especially one as important as our youngest residents' health and birth outcomes. We know that healthy birth outcomes are the first step in reducing poverty and disparities in our next generation. The future of our city depends on it, and depends on all of us. Now we'd like to open up this conversation to questions from the media. We're going to use the raise hand function. You all should have received instructions, but go over them very quickly. You should see a hand icon in the bottom right corner of your screen. Click on the hand and you'll see a hand next to your name in the attendee list. That's how we know you have raised your hand. We'll unmute you to ask your question. Please state your name and your media outlet. After your question's been addressed, please click the hand next to your name to turn off the function. If you have additional questions or follow-up, please click it again. And with that, we will take your questions. Looks like our first question is from Paige. Paige, could you introduce yourself and your organization? That's your question.
Hi, everybody. Thanks for having me. This is Paige from WOSU. I just wanted to ask, I guess, about the pandemic and the impact that the pandemic has had on infant mortality. Just looking at some statistics, I know that more babies have died before their first birthday in the first kind of 6 months of this year in comparison to last year. Can you talk a little bit about just how the pandemic has impacted numbers and what exactly is being done about that?
Director Stapleton, do you want to take that one?
I sure can. Paige, thanks for the question. We were all very, very concerned with the pandemic and what impact it would make. And we did see in early 2020 a spike in infant mortality. We are pleased to report, and you should have a copy of the data dashboard through the third quarter of 2020. We are pleased to report that that spike was just that, a spike, and it's back down to the 6.9 number that we ended out 2019 with. So we're very, very pleased that while we know that we still have fourth quarter numbers to synthesize and analyze, we are back to the numbers at the end of the third quarter that we were in at the end of 2019.
Maybe I could add on to that. One of the silver linings actually that we've seen in the pandemic is that the number of premature births has gone down. This has been a national phenomena, been reported on through the New York Times, and we've experienced it here. And some of the spike we saw this year was because preterm births were going up in the prior year. That has mitigated, and whether that's associated with different viruses that mothers aren't being impacted by or different stress factors, we really don't know the answer. But one of the silver linings has been that we've seen that down. Birth rates are down a little bit as well. But we're concerned more generally just in terms of making sure that mothers are getting access to prenatal care and all of those other types of things that has become more challenging during the pandemic.
Thank you both for your responses there. Are there any other questions from the press this morning? Well, if there are any additional questions from the press, please feel free to follow up with Robin Davis in my office or Maureen's team at CelebrateOne, and we can get those if we need questions or any responses from Tim and his team at Nationwide Children's Hospital. But again, so grateful for the entire community's effort. We wouldn't be where we are today realizing an 18% decrease in infant mortality and having the African-American infant mortality rate decrease by 33% without this entire community's collective effort. Know that the work ahead will be some of our most challenging because if we are really committed to addressing racial disparities, we will be taking on some of the biggest challenges and issues in this community to make sure that we are successful. And this is all about the lives and the future of this city and community. This work has never been more important. and I'm grateful to the partners that have helped get us to where we are. And now is time for us to leverage this incredible momentum we built, this movement in this community to celebrate, lift up, and make sure that our youngest residents are thriving into the generation that they are going to build for all of us. Thank you all for joining us here this morning, and look forward to seeing you out there soon. Stay safe, stay healthy, be well.